Hello viewers, today we are going to talk about starting positions. Starting position is something that we have to note before prescribing any exercises to the patients according to their conditions and their needs. So this, as a physiotherapist, everybody should monitor. Sherrington once said, movement follows posture and movement ends in a posture. So the starting position is so important, so we can select the exercise according to the patient's need and necessity. Here, while starting the position, the posture should be noted, and the voluntary involvement of the patient is also necessary to perform the exercises. So first we will see about what are the different types of starting positions. Starting positions is of 5 types. First is standing, second is kneeling, third is sitting, fourth is lying, and fifth one hanging. So all these positions should be correctly done to accomplish the exercises, and all its effects reaches the concerned muscle we are targeting. Okay. So the active involvement of the patient or the person who is performing the exercise or the task should be monitored, and so the starting position should be compulsorily watched. So first we will talk about standing. Among all the starting positions, standing is little difficult position, and it involves balance and perfect posture maintenance, and whole body got to work. So I'll explain the starting positions with a model. So the first starting position is standing. Now standing, we'll talk from the foot to the head. Okay, what are the positions you have to watch at each joint level, we'll see. So first you have to have your feet together and toes apart. So both the foot forms 45 degrees angulation. The angle between both the foot does not exceed 45 degrees, and your foot is everted and is in neutral position. Ankle is in neutral position. Knee is locked position, extended and in neutral position. It comes to the hip. Hip is not flexed or extended, it is a neutral position. Pelvis balance. Pelvis are balanced on the head of the femur exactly. And spine is erect, and you have the shoulders retracted and chin tucked in, your head straight. Ears are onto the side, eyes looking forward. So this, and the hand lies by the side, palm facing inward. Palm is facing inward. So this is the starting position. So these are the positions of the joints we saw, an ideal standing posture. Now what are the muscles working? Muscles work. So when we see in the foot, what are the muscles actively working is the plantar flexor, the everters and the dorsiflexor. These 3 muscles work as if 3 guy ropes. Together they work, so you can balance exactly on the floor, so you can balance the whole body on the foot. And the knee extensors are holding the position in extension, and the hip flexors and the hip extensors are working to maintain the neutral extension, counteracting the gravity and maintaining the hip extension. Lumbar spine is extended and holding the lumbar spine erect. Shoulder retractors are working to hold the shoulder in position, and both cervical flexor and extensors are working together to counterbalance the head on top of the center of gravity. So these are the muscles working here. So this position can be selected when we are seeing the uses of this position. You can prescribe this starting position only when a person is able to balance themselves exactly with a very short base of support, only you can prescribe these exercises. So they can balance themselves on a very smaller space and move their body around. You can prescribe this exercise. Otherwise it is difficult. Balance is very, very important to maintain this starting position. In this small variations can happen. The foot you can have inner borders parallel to each other. Inner borders parallel to each other. According to the exercise we can, but still balance and concentration of the maintaining the posture is important. That is why we maintain this thing. The second starting position is kneeling. In this position everything is the same except the whole body is getting balanced on the femoral condyles. The whole leg below the knee till the foot is in relaxed position. Yeah, but the whole body is getting balanced on the knee. So let's see what are the muscles getting work here. The muscles of knee, that is the knee extensor and the knee flexor, are equally working to maintain the whole body's weight, balancing the whole body on top of it, and the hip flexors are contracting the erect spine here, and the hip extensor also acting in relation. So they are working together to maintain the pelvic tilt in neutral position. So they are balancing the whole body weight on the lower leg. And now the shoulders are retracted, and again cervical flexor and extensors are working together to maintain the vertex on top of the center of gravity. Here this uses of this starting position is, we usually prescribe these exercises to propel or to progress to the standing posture. When the patient is getting trained to move forward, he can place one leg forward, so he can progress to and train himself to standing positions. That is where we use this kneeling posture, or we can use this kneeling to train the pelvic surrounding pelvic stabilization kind of exercises. You can prescribe this kneeling thing. Same way, when they are able to balance themselves, this kneeling can be prescribed. The third starting position is sitting. In sitting, the person sits with his spine erect and the whole lower body is in relaxed position. Here, the foot is normally placed on the ground. The ankle is in neutral position and the knee is flexed to 90 degrees, right, perpendicular to the floor and perpendicular to the thigh. So 90 degrees flexed, and the hip is also straight and it is also flexed to 90 degrees. Now the lumbar spine directly transmits the weight to the hip, the pelvic, to the ischial tuberosity. So exactly on the hip it transmits. Now as lumbar spine is erect, back, the whole vertebral column, the whole back is erect position, extended position, and the shoulder is retracted and the cervical spine is in a neutral position. The vertex is exactly balancing on the center of gravity, and the hands are placed on the lap or on the thigh to have a comfortable position. So here you can see the elbow is little slightly flexed. The hand position can change according to the exercise you are going to prescribe. So here the lateral sides are also being taken into consideration. So they do not lean on exact side. The rotatory kind of exercises, the exercises for back and pelvic postures can be trained in this starting positions. So here when the person is not able to balance themselves, not little weak, they are still need more strength, they can adopt this starting position to learn the exercises and perform the exercises. Now the fourth starting position is lying. In this, the patient or the person lies on the couch with their back resting, they are facing the roof. The exact posture of starting position in lying is, the person's foot angle is neutral, their toes face exactly the seat, points to the ceiling or the rooftop, wherever it is, it got to face the rooftop. So the person is able to take up any exercise in that position. So toes are facing the rooftop, the knee is in locked position, the hip is in neutral and relaxed position, the whole spine is relaxed and resting, the shoulders are also retracted and lying, the arms are lying by the side, and the person's eyes should look to the roof, chin pointing up. So these are the important aspects you should note in a lying position. So, in a supine lying, the person lies in this relaxed position. The muscles working here are dorsiflexors and the everters only. So, they are maintaining the foot posture to take up any exercise or activities relaxedly, and the rotators of the cervical region are working to maintain the head in neutral position facing up. So, this is a relaxed starting position on the supine thing. In this position, what are the exercises we can prescribe? For what exercises we use these positions are when the person is about to start, they are not very weak, they are about to get mobilized after post immobilizations or after their recovery from ICU, all these things, we all start the exercise from this lying position only. So, we can do all the free exercises for the lower joint, for the arm, for the shoulder, for the elbow and spine rotation, all these things in this lying position. It's a very comfortable position for any patients. So, they no need to take in count of balance or any other aspect. So, a person can adopt this position to start. So, there is no gravity acting, so elimination of gravity. So, many exercises that can be done on elimination of gravity can take this lying position. So, when you start these exercises, hoping the starting positions are correct, the exercises correctly impacts the muscle you are targeting. This is the starting position for hanging. The whole lumbar spine is erect, the cervical region is high above, long as possible. The chin is held high above. The chin is up, so the neck is extended and it pulls up like that, and the foot, exactly the hip, everything is in your hip, knee neutral, the ankle is plantar flexed. The starting position for hanging. In this position, the muscle that is exactly going to work are the extrinsic muscles of forearm for the grip, and the latissimus dorsi that is going to depress you and pull up and pull down. So, for strengthening latissimus dorsi, this hanging position is usually selected. So, maintaining this posture, all your arm muscles are working right from the extrinsic flexors and extensors and the abductors and internal rotators of the upper limb, and the back extensors, abdominal flexors and hip extensors to maintain the pelvis in neutral position, and the knee extensors are working to counterbalance each other, and here plantar flexors and inverters are working to maintain the ankle and the foot position. So, hanging only if the foot is above 3 feet, you can effectively do the exercise prescribed in this position. Uses of this hanging position, usually we prescribe this exercise to strengthen the latissimus dorsi, the powerful depressor in the whole body. So, latissimus dorsi starts depressing this and pull your body above the gravity and strengthens this muscle. It also strengthens your abductors of the shoulders and the latissimus dorsi. So, the person who can hold himself in this position alone is being given. They can balance themselves on this position. So, so long we were seeing about the starting position. I hope this is more useful to you. You will have a good idea about starting position, why it is important to note the starting positions, and when and all to select and use the starting positions, and the derived positions from the starting positions will be recorded in the next video. Thank you.